Hey everyone, my name is Ashley Broussard. I'm honored to present my quality improvement initiative focused on reducing patient falls on Unit 3 at the Veterans Home in Jennings, Louisiana. The project is part of my clinical experience and from my capstone for nursing 405, and it reflects both academic research and real world experience from my work as a hospice nurse. Falls are one of the most common and preventable safety issues in long term care settings. They're not just physical events, they're emotional ones too. A fall can lead to serious injuries, such as breaking a hip. And we all know whenever that happens that it's detrimental for the patient. A lot of times they're never the same. And this can be very emotional for the patient, for their loved ones, and anyone who is taking care of the patient. Um, For families, it's very heartbreaking. For staff, it's stressful when this happens, especially whenever it's avoidable. That's why this type of initiative matters. I'm going to start by sharing what prompted this project. Allison is one of my friends, and she is the unit supervisor on Unit 3 at the Veterans Home. And we began having a chat. I go in there to see some patients, and she said that they were having increased falls um, over the last quarter. She said her unit had more falls than any other unit in the whole entire place. They weren't isolated events, they were part of a pattern. Staff are overwhelmed, communication is inconsistent between shifts, and training on fall prevention was limited. She described them having a lot of huddles, but that the huddles were ineffective due to not the right kind of people being on the huddle. During a meeting with Allison, we discussed those concerns and decided to dig deeper. I did use the Five Whys tool from the Health Quality Ontario to identify the root causes, and we found that inadequate staffing, poor shift communication, some environmental hazards, and gaps in training were all contributing to the fall problem, the increased falling problem. And those findings shaped the direction of this project. So, what's the aim? We want to reduce falls on Unit 3 by 30% by March 21st of 2026. It's a bold goal, but it is achievable, and it's grounded in both the facility's needs and national benchmarks. The Centers for Medicare and Medicaid Services track fall rates as a key quality indicator, and the facility's own QIPI reviews have highlighted this issue as a priority. To support the aim, I reviewed literature and guidelines. Muhlenbrooks et al. Conducted an umbrella review showing that improved staffing and supervision directly reduced fall rates. Schobert et al. Emphasized the importance of individualized care planning and staff engagement. Turner et al. Found that embedding fall prevention into daily workflows, such as EMR prompts and visual cues, were able to consistently improve and reduce the risk of falling. Based on the evidence, I was able to develop a three-part intervention strategy. First, what they will do is implement staff education modules, which are going to be rolled out in the form of educational packets that they can be tested on, focused on fall risk detection, prevention methods, and personalized care planning. So it's going to include nurses and aides that are on the unit. The modules will be short but practical and reinforced through their weekly safety huddles and visual reminders around the unit. The second part of the initiative that's going to be rolled out was to improve environmental safety, and monthly audits will help to identify hazards like poor lighting or cluttered walkways. Sometimes what happens is patients' walkers in the way or the wheelchairs are in the way and so it's going to be the staff are going to be really looking out for these things and keeping those things out of the way of the residents if they are ambulatory. They will install nightlights as soon as Allison is able to get the okay, because sometimes they don't like the overhead lights, which provide a lot of light at nighttime, but the residents can't sleep. So, me and Allison talked about nightlights being more appropriate instead of those overhead lights. And then there'll be signs reminding the residents to call for help. Um, these types of changes are low cost, but hopefully they will have a higher impact. According to evidence, these types of things do have a high impact. The third thing that the part of the initiative that's going to be rolled out is to standardize communication protocols between the shifts. That's been something that's been lacking, and it's been a major area where from shift to shift things aren't being communicated, and just that whole entire process needs to be revamped. So shift handoffs will include a fall risk update using a consistent template. So it will just be like a handoff sheet that lists all the patients who are high risk for falling, if they're more confused, neuro things, if they have new depression, nuanced depression, or a worsening depression, um, anything like that, any, or if they've had a recent fall. Um, this ensures that every team member is aware of who's at risk and what interventions are in place. Now we're going to talk about how to measure success. Using three types of measures, which are outlined in our textbook, outcome, process, and balancing measures. Have learned a lot about this. I knew a lot about quality prior to, but I have learned a lot about this during this process. Outcome measures will track what matters most to the residents: monthly fall rates, injury severity, and satisfaction scores related to safety. For residents with cognitive impairment, family members will complete satisfaction surveys. So, part of the initiative is that surveys are going to be sent out to patients, and if they're cognitively impaired, to their family members. Um, process measures will help to see if the interventions are being carried out. We'll monitor. Well, Allison will monitor things such as training completion for the modules, and then the frequency of safety huddles and the consistency of environmental audits. The safety huddles are going to be happening every day. Um, Me and Allison had a conversation earlier this week, and she said that they already do have these huddles, but they're going to be kind of revamping how they're structured on her unit. Balancing measures will ensure that efforts don't create new problems. So we don't want any of our interventions to make more of a problem for the staff. That's overshooting the mark, and that's not at all what we want. So she'll get staff feedback on workload, documentation time, and whether other care tasks are being delayed due to the fall prevention focus. Data collection will begin on October 21st, 2025, and continue through March 21st, 2016. Incident reports will be reviewed weekly. Training attendance will be logged by the unit supervisor, Allison. Environmental audits will also be logged by Allison, and they're going to use a standardized checklist. Staff feedback will be gathered through short surveys and informal check ins during huddles. The unit supervisor, Allison, will oversee data collection and delegate tasks to staff nurses. Their facilities quality improvement team, which meets once a month, it's comprised of like the DON, the ADON, unit supervisors. Um, they meet once a month. They'll assist in analysis and documentation, and they'll review these things as they have been during the monthly QAPI reviews. To evaluate success, data will be compared from the beginning, from the baseline and the previous quarter to the end. And what we're looking for is a 30% reduction in fall rates that will indicate that the interventions have been effective. They'll also look at trends in injury severity and satisfaction scores to assess the overall impact. Weekly reviews of process measures will help them to stay on track. If they find issues, they will use the cycle that they use. It's kind of like a plan, do, study, act cycle, but what they do is they have a QAPI. Basically, it's a form. They want to improve something, and they'll keep on coming back to it. They have goals, reduction rates, and then they will keep coming back to it and altering it with different interventions until the quality goal is met. That'll allow them to change things in real time and adjust and tweak things as needed. Sustainability is a key part of the initiative, and we don't really want it to be a one-time fix because that's kind of a lot what happens. Instead, this needs to be a long-lasting change for the unit to support that. Allison will continue leading daily huddles and monitoring fall-related updates. The quality improvement team are going to use those monthly QAPI plans to refine interventions and track the progress. Nursing leadership will advocate for policy changes and budget support. So Allison said she was going to advocate for some budget allowances regarding like the night lights and things like that. Um, Allison will choose a champion on her shift, a nurse, probably a nurse who is accepting of the initiative and who's willing to help. Um, and she will encourage them. That strategy is also evidence based, is supported by Showbearer, who emphasize the importance of staff ownership and individualized care planning and maintaining long term change. Integrating fall prevention into everyday workflows and supporting it with education helps the facility develop a long term safety culture. That's the ultimate goal. Of course, there are some barriers that are anticipated: staff resistance to new protocols, time constraints for training, and budget limitations. These are all real concerns. To address these, training will be integrated into existing meetings, and it'll just be these little the modules on paper. Um, Visual cues will reduce the cognitive load. Allison will advocate for those small budget reallocations as well for the environmental upgrades. The timeline structure is structured and realistic. From October 6th to October 20th, the protocols will be finalized and training materials will be prepared. From October 21st to November 4th, staff education will be launched and modules will begin, and then safety huddles as well. The environment audits will start on November 5th and continue to the end of the month. Full implementation, including individualized care plans, standard communication protocols, and ongoing audits, will occur from December through March. And then in March, she'll evaluate the outcomes, analyze all the data, and report the results. This initiative is designed to be cost effective. Staff education modules will include handouts and brief post module tests. Environmental upgrades like nightlights and signage will involve minimal costs are expected to reduce fall-related injuries and hospital transfers. These changes will also enhance the CMS quality ratings. I'm going to close by emphasizing the impact of this work. Falls in long-term care settings are preventable most of the time. Sometimes they aren't, but they affect the lives of residents, families, and staff. By implementing structured education, improving environmental safety, and standardizing communication, we can reduce falls and promote a culture of safety. This project is grounded in evidence and shaped by experience and aligned with national guidelines. It reflects commitment to dignity, safety, and ongoing improvement, values that define effective leadership and compassionate nursing practice. Thank you for your time. I welcome your feedback and support.